Carol Bones.
Yeah, doctor. I'm Carol. Yeah.
Okay. And how are you related to Susan Bones?
Yeah. My mother is Susan Booms. Yeah.
Okay, may I just confirm her age, please?
She's 78, doctor.
Okay, thank you. Is it all right if I call you Carol?
Yeah. Yeah. Sure. Carol is good.
Okay. Um, all right, Carol. So I'm here to talk to you today about your mother's condition and to give you an update about it and to answer any questions that you may have.
Okay. Yeah. Sure, doctor. Please tell me. Yeah.
Okay. So just before we begin, I'd like to start by asking you a couple of questions. Um, because this is the first time that we're meeting physically with you and I. So I'd just like to ask a couple of questions. Um, are you here today with anyone at all?
No. No, doctor. I'm here alone.
Okay. So what do you understand about your mother's condition so far?
I know that I actually came here because she's been losing. She's been not eating properly. That we have experienced. Uh, I know that she's been having dementia last 3 years or so. Uh, yeah, she's getting treatment, but she's getting worse. Doctor. I don't know what I can do.
Mm. I'm really sorry to hear that and to hear that your mother's condition hasn't been improving. It must be quite hard to take this swallow. Um,
Could you just
so when you
repeat that?
mentioned that she's, pardon?
Could you just repeat that again?
I'm really sorry to hear that your mother's been going through all of this, and
Mm.
that it must be quite hard for you to
Yeah,
watch her experience this. You mentioned
yeah,
about the weight loss,
yeah.
and how long has this been going on for?
It's been the last weeks. I mean, last four. She always used to be okay, happy, but last 4 weeks she just you know, losing weight. Mainly, she's not eating first place.
Okay. And has she been having any vomiting, diarrhea?
No, doctor, nothing.
And has this happened in the past at all?
No, doctor, this is the first time.
Um, have you noticed any changes in her mental condition, in her behavior, perhaps?
I guess she's just getting worse. I mean, she doesn't even recognize me anymore. She just yells at me sometimes. Yeah, status has gotten worse.
Okay. I'm really sorry to hear that. Um, and just a couple more questions, and I'll give you an update if that's all right. Have you do you know if she has any other medical conditions?
No, doctor, nothing.
You know about any drug or food allergies?
No, doctor.
Okay. And who does she stay with at home?
With me, we just stay, both of us.
Okay. So do you have any? Is it just the two of you? Anyone else that comes by perhaps to visit?
No, not really, doctor. That is something that's actually bothering me a lot too. I'm having to take care of her alone.
And what do you normally do in your daily life?
I work as a receptionist.
Is this full time?
Sorry.
Is that full time work?
Yeah, yeah, doctor, and that's also getting very difficult to manage and financially too.
Mm, I can only imagine. It must be really hard. I'm so sorry that you had to go through this.
Mm,
Would you like to have anyone else here with you?
no, no, I'm okay. I'm okay. But what happened, doctor?
Okay, so just That's good. So I'm just going to give you an update. We've done a couple of investigations to find out why she was losing so much weight. And so we did a couple of blood tests and also imaging tests. So we did some x-rays, ultrasound scans, and all the investigations came back normal, which
Oh,
means that her,
so that's good then.
her
So it's all normal.
well, we hope it would um, that it would be good news, but unfortunately, I'm so sorry to tell you that the news that these normal investigations mean that
Minutes remaining.
your mother's weight loss is due to dementia, which means that at the end stage of dementia, um, someone will start losing weight because of the dementia.
Oh, I mean, do you mean she's? You said end stage. What does that mean, doctor? What are you trying to say?
It means that because of these investigations that we've carried out, we've realized that your mother, no other intervention or treatment would help her, and she's reached the final stage of dementia. So we can only we can do certain things to help relieve her pain, make sure she's comfortable and surrounded by loved ones such as yourself, and make
Uh,
her keep her dignity as well.
will she
But
get better?
nothing else medical.
I mean, I'm willing to do anything, but will she get better? I mean,
I'm so sorry to tell you, but she probably won't be getting better because of this.
oh, so are you saying she's going to die?
Not at this very moment, but because it's progressive, it means that the situation is not going to improve from this point. Um, so what we can do is make her comfortable, support you. We can connect you up to certain people that will help support you as well, maybe at home. Um, maybe provide a carer to come and assist you, but we won't be doing any other medical interventions.
I mean, what do I do now, doctor? Can I take her home or?
Um, for now, while we try and sort out the care.
To the next station.
Hey, that was really good. Um, all right, I think.
Volunteering to be a candidate. Thank you so much for that. The overall great performance, I have to say. This is again one of the difficult stations of breaking bad news. So usually, how we approach this station is something called an approach of spikes. Just everybody who's heard of this, just raise your hands on the screen so that I don't know if I want to explain this any further. Have you guys heard of the spikes approach? Go into explaining that a little bit more. So, so this is a station where you're going to give like a very bad prognostic, prognosis for a disease. So, the way you approach it is, it should be very sensitive. So, spikes where is the usual approach that people use to say something that is terminal or progressive, right? So, S stands for the setting. So, Dr. Saida actually, Anisa actually did. Do that well. So we'll have the important points up soon, but just to give you an overview. So the setting, you need to understand who she's with, where she is she comfortable enough to talk, right? P is for perception. So that is something that you could have understood a little bit more about. So perception is how much do you understand about this condition? So she asked her, like, how much do you understand about your mother's condition? But the main thing that you wanted to her to know is how much do you understand about dementia itself? Because when you're trying to tell her that this is terminal, this is end of life, you need to make that connection for her. Like what the patient is come with is that the mother has weight loss, right? And she doesn't know why she has weight loss. She has these other conditions of dementia and all that. But you need to make that connection clear to her that this weight loss is because of the dementia. And this usually happens in dementia towards the end. And dementia is such a disease that is progressive and is irreversible. So at this point, if you give all this information to her, then they will understand for sure that this is not something that they can treat, right? So, but then you're like, yeah, this weight loss is due to dementia. You mentioned that, and this is something that we can't do anything about. But why? But why? I mean, what is so much about dementia that would cause her weight loss and ultimate, towards the terminal part of life, right? So that is a connection that you need to make for them, right? You need to tell them that this is because of this and this condition is such, right? So that's a perception. So you're trying to understand how much they understand so that you can fill in the gaps. So you have to understand. So it's similar to ice, where you're trying to understand what their idea is and what their main concern is and what do they expect from coming to the hospital, right? So that is P. So SPI is the invitation when you're going to break the news. So let's individually look at the points. So the full name, that was very good. You asked the full name and age, and confirm the understanding for the reasons, for the mother's reason for hospitalization. So so she's admitted in the hospital. Ask her a little bit, why do you think she got admitted? What was the thing? So it was mentioned that yeah, she has weight loss, that's why she came to hospital, she's not been eating. Yeah, but you could have asked it in a way that it would go into a discussion, right? Like, proceed to talking about dementia soon. So she came with weight loss, and you need to understand to make that connection for dementia. Like, all right, so does she have any other conditions that you know of? So it'll be like, yeah, she has dementia. All right, so what do you understand about dementia? Could you tell me a little bit that you understand? They'll be like, yeah, her memory is lost, because that's what we all understand about. I mean, if it's a lay person and it's not a medical professional, that's what they understand about dementia, that it's a mental condition. Like, it's affecting them, their mental capacity. But why would that affect their physical self? That is the connection that you have to bring about for them, right? So how much do you understand? That's where perception comes. And then once you understand what all she understands, then give the invitation to, do you want, invitation is, would you like anybody to join you when I tell you the results? Do you want anybody to be present? But before that, you have to do a little bit more data gathering. Like, who is the primary caretaker? So you asked her, like, who stays at home. That's very good. But you need to understand, are there other caretakers? Like, this is a condition that she's been having for the past 4 weeks. How have you guys been dealing with it? If she doesn't eat or drink, what have you people tried doing? Try to say that this is why you're trying to get that out of her, because because they've also tried, and so have we. Even after all that trying, you can also see that it's not going anywhere, right? So those are some of the things that you want to get out of them, so that when you're talking about the disease itself, or most of it they've already covered in the perception part, because these are the top points you want to touch upon on in management. All right. So so primary caretaker, how is she currently supporting her? Does she need any help? She mentioned she's a secretary and she has some financial issues. So that is something that you picked up from data gathering. Very good. But you should have brought it back in management, because you have to offer her support for what she's going through, right? So we'll get to that, because ultimately the care that you're offering is a holistic care. You want to relieve them of all the problems that they are actually facing, or at least support them enough, right? So that was one thing. And understanding of dementia, how much she understood about dementia, that could have that you could have actually got that progression and irreversibility out of the the simulator. Or else you could have brought it about, because this is something that you don't understand. I just want to tell you something extra about dementia that would clear out some of the understanding that you have about the condition, right? And details about awareness of the test. So you should have asked, like, do you know what happened in the hospital? Do you are you aware of any of the tests that has happened? So you're asking what they know so far, like literally until the point that they're talking to you, what all has been told to you, so that you can just fill in the gaps. So if you do the data gathering such that they give you a comprehensive idea of what has happened till the point where they talk to you, then it'll be easier to break the news to them, right? So you could have asked that one question in data gathering as well. Then once you have all this information, then you go on to the invitation part. So ask them, is there any family member that you would like so to be present when I'm giving you this information, when we are having the discussion. So then, I mean, this is a very tricky place, because mostly usually people ask, why doctor, why do you, why should I have somebody? So you don't know how to get back from that. I mean, you have to reveal that it's a terminal condition, but you can't reveal it immediately. So we're like, okay, so then just move on. If it's an uncomfortable question, just move on. So from our conversation, I understand that you have mentioned that your mother has been having weight loss, and she has been diagnosed with dementia before that, for which she's on medication. But one thing that I'd like to tell you about dementia is that it is a condition that is progressive and irreversible, meaning it'll just keep getting worse, and there is no coming back from the stage where she is, right? So once you tell them that, then they're trying to, okay, then their mind gets opened up about one aspect. So you have to layer the information before you tell them that it's terminal, because when you said it was terminal, it was very abrupt. Like, you should give them a chance to react to the fact that her mother is dying, because it's a very sensitive case. So first, invitation. And if the invitation, if suppose they don't want anybody around, or if it becomes awkward, then start talking about it, right? SPIK. K is the knowledge. So you're telling them now what is happening. So after they're understanding that perception, now you're telling them what's happening. So tell them about, but when you're giving the knowledge, you have to give it in a way that it's layered. You have to tell them from one aspect to the other, and bring about that, association. So first of all, she's been having weight loss. She has dementia, and dementia is a progressive and irreversible condition. And unfortunately, this weight loss that she's been experiencing, and this refusal to eat, is one of the terminal symptoms of dementia, right? So you've literally brought that together. So that's when they understand that, all right, both of them are related. I see. Now we have done a couple of blood investigations, we've done imaging, and it's all come back normal. So literally, so you asked a little bit about, does she have allergy and all that. Those aspects of data gathering are not important here, because the diagnosis. You're trying to tell them the diagnosis, right? So all these aspects, this is not a simple history taking case. This is where you already know the diagnosis, and you're trying to understand how much they understand, so that it's easier for you to tell, right? So that's why you need to make sure, because another thing, you ran out of time. You couldn't mention everything that you wanted. You didn't mention much about the palliative care, which was the ask of the task. So if you go back to palliative care, if you go back to the question, um okay, sorry. So if you go back to the question, the need for you was to go and explain the patient what palliative care was, which you didn't have much time for, right? Because you ended up asking data gathering questions which were not that important. Do you understand? All right. Yeah. So if you see the question, so palliative care has been decided by the consultants, right? That part has not really, come out properly. And that is again something that is a decision by the consultants itself, right? So you're not asking them anything, that what kind of care do you want. You're trying to tell them that this is the condition, and now the next important course of treatment would be palliative care, right? So we'll go back to the sheet again, and we'll go point by point. So yeah, so you could have brought that. So then your ultimate knowledge, when you're giving it to them, you have to layer it slowly from whatever you've gathered. Like, she's had weight loss, she has dementia, it's terminal and it's progressive, and this weight loss is because of dementia. We know this because we did all sorts of tests to see if there are any underlying pathologies, and unfortunately there aren't any, and all the tests have come negative. So, unfortunately, I have to tell you that this is the terminal stages of dementia, right? So then they'll be like, what? So then, after you say the diagnosis that this is terminal dementia, then they'll be like, they'll be a little jarred. You've given them so much information at that point. So, you should give them that 1 minute to respond to what you just said, right? So, that 1 minute, after that 1 minute, or after that, not exactly 1 minute, you should give them time to respond exactly. So after you say that it's dementia, after you've revealed the diagnosis, wait for their response, because your next response should be tailored to their response. So they'll be like, they can be thrown off, they'll start crying, they might have so many other simulations. So that is where your IPS also shows that you've given them this devastating news. So give them time to respond. So if they so suppose if I'll be like, what? And then I start crying, then wait for it. I'm so sorry about this. Would you like some tissues? Would you like a glass of water? That's when it comes in, because you can see what the reaction is. Wait for them, and then be like, are you okay to proceed? And then continue talking, right? That way you'll also, these are all cues where you can get points for management. I'm sorry, IPS, right? So these are all, that's what shows that you're caring and you're bothered. I mean, you're more concerned about what their reaction is. So right, so after you reveal the diagnosis, they'll have a response and be like, what are you saying? Are you saying she's dying? Some of them also respond like that. So then you can stop and say that, I'm extremely sorry to tell you, but unfortunately that's what it looks like, right? This stage of dementia is irreversible, so from here there is no coming back. Just break it down to them. Don't say, yeah, you say that you said it was probable, definitely, yeah, but phrase it in a way that it's more little sympathetic, that I'm so sorry you're feeling this way, but unfortunately this is the situation at hand. Like, you have to be very empathetic when you're saying that they're dying, right? So the knowledge is passed on of what the condition is, the associations have been made, of the weight loss and dementia has been explained, and the fact that it's terminal has also been explained. So that is all, that's the main thing that you had to do. Now the task at hand is you have to explain about the palliative care. That is main now. The management is basically that, right? So unfortunately, if you see, you haven't gotten much to that point because you ran out of a lot of time there. So all right, so now so then they'll be like, what do I do next? So be like, all right, so our team of doctors, we have decided for something called palliative care. You can drop the name, but ask them, do you know what that means? So they'll have a perception, and or they might not. Depending upon their response, how much perception they have, you can actually give them the added information, whatever their knowledge is lacking at, the knowledge gap. So go like, all right, what is palliative? I'm not sure what is it. It's like, it's something that it's the part of medicine that takes care of usually keeping a patient comfortable, especially in their last terminal stages of life, right? Like, simple explanation, like if the patient feels pain, or if they have any vomiting sensation, if they are finding it difficult to go to sleep, we'll give them medication so that they are comfortable, in these last stages of life, right? Because there is not much that we can do. So then she might get a little aggressive, saying that, what are you saying? You're giving up on her. You can't do anything. So this case can be taken in a lot of directions. So it could be like, are you saying you're giving up on me? Giving up on her? I'm her daughter. She's taking care of me. How is it that I can't do anything? So then you'll have to start explaining that aspect of it. That if we do anything, it's not going to benefit her anymore. So that risk versus benefit, that particular aspect you'll have to bring. So sometimes this case can go into a direction where they go like, I've heard of something called a feeding tube, why can't you do that? So then, that puts you in a position where you can explain that, yes, there are treatments that we can give, but at this point your mother is conscious. So if we aggressively treat her, it's not going to help her much. Instead, it's going to harm her more. And you don't want to harm a person who is this incapacitated. That is something we try to avoid. So any management from here on would be aggressive, and it might not be very comfortable for your mother. From our discussions with our team of doctors, this is what we have planned would be the best next step. Explain it to her like that. Like, because they'll have a lot of ideas, because you're literally telling them that, we're giving up on your mother, right? So you'll have to explain that point very clearly, that we're not giving up, but this is the next best step to take, right? So there will be another situation where be like, I want to take her home, like, what is it that I don't want her to be in the hospital and all. So then you can talk about hospice. So it can also go into that direction, that we can talk about hospice, right? So after all that, now how do you end the station? That's important. So now after you've already spoken about all that, so depending upon the direction the conversation takes, you have to answer those questions, because the simulator might have a couple of prompts. They have an option of prompts of what all it can be, right? It can go into the home management, it can go into ED management, or it can both, can also be there depending upon the time. But how do you usually end the station? So now say that, all right, I'm sorry, this might be a lot of information to take. How about we set up a follow up with your GP? If you have any doubts, any questions, anything that you want to ask, you can reach out to us, right? Or follow up. Safety netting won't be anything that you can do over here. Leaflets and pamphlets, give them a little bit about, how about I give you some things about palliative care, so that you know a little bit about what the treatment plan we have entailed for your mother, right? That you want to keep them informed. So this, so what we are trying to do is that whenever we are letting the patient leave, or the relative leave, we're trying to give them all the information. For us, the best patient is the well informed patient, so we're giving them resources for that, right? So leaflets, pamphlets, follow up can happen there, right? Or else you can get them in touch with the hospice care, who can also, you can also give them as an added point that they can provide you additional care at home if that's something that you want. Or we can get you in touch with other groups who are more focused in providing specific resources for dementia in the UK. Those are added points, but if you have time. But ultimately, the main thing you understood, right? The whole point is to give them that news and to tell them what is the next treatment plan that we have for you, in store for you. Yeah. So that's about this case. And there are a lot of opportunities in this case to actually have an IPS conversation. There are points where you can actually make the examiner aware of your IPS. That point where you're revealing the diagnosis, waiting for them to respond, right? Sometimes you have to make those opportunities where you are actually showing your IPS and it's evident. Yeah, I hope that was helpful. All right, guys.
Huge.